As cases climb among young people, experts are concerned about containing the spread of COVID-19. So how can that affect other family members? Joining us now to give us his perspective, Dr. Nicholas Testa, Chief Medical Officer of Dignity Health, Southern California. Dr. Testa, good morning. Yes, good morning to you.
Still the morning.
We're starting to see the highest rate of positive cases among young people, and they think they're invincible. Maybe they are, but they're spreading it to other people, right?
Of course. So we're definitely seeing an increase in spread, and figuring out how we maintain that through solid quarantine is one of the most important things we're going to do.
And is that really the key? Just solid quarantine? Are there other things we can do to reverse this trend?
Well, quarantining a patient once they know that they're COVID positive is going to be one of the most important things, and doing it correctly, because the CDC just updated their guidelines on how we quarantine. So people need to know that you need to, after you test positive, stay quarantined for 10 full days. And then you need to go a full 24 hours without a fever. And that's all under the assumption that your symptoms aren't getting worse.
And one of the things that jumps out at me, recently there was a representative that was asymptomatic, and the only reason he found out he had COVID was he was being tested because he was going to be near President Trump. When I think of these young people, they might be asymptomatic. I mean, what do you tell people right now when they might be sick and they don't even feel bad?
Wear a mask. Right? That's why we're all wearing the mask. The mask isn't actually about preventing you from getting sick as much as it is to prevent somebody who is in that preclinical phase where they haven't developed any symptoms from spreading it in the community to somebody else. So I say wear a mask, wash your hands, cover your cough, and continue social distancing.
Yeah, it does. And it seems like that's even more important now because people think that we're all getting a handle on this and more people are out and about. But one of the things that everybody's talked about, loss of taste and smell, it appears to be a symptom for a lot of young people. What should they do if they notice this? I mean, do you automatically assume you're sick if you suddenly lose a sense of taste and smell?
Yeah, so what we're seeing is that anosmia, which is that loss of smell, is one of the first and early symptoms. I think right now with what's going on, if anyone experiences that, I think you make an assumption that you have COVID-19 based on what's going on in society. Now, why do you lose your sense of smell is interesting. We don't exactly know, but what we do know is that it comes back relatively quickly. So you're not actually infecting the neural endings in the olfactory bulb, it's the tissues around it. So what they do need to know is if you do think you lose your sense of smell, then you need to get tested or quarantine, and know that it will come back in a short amount of time.
Very quickly, does it fascinate you what we're going through here with COVID? Because the things that you just described, we're learning so much day to day, week to week, month to month over this brand new virus.
Oh, yeah. Yeah. I mean, as a scientist and a clinician, I find it, fascinating as far as the disease goes, is we're seeing new studies every day. And the thing that's most interesting is we're doing it across borders. So studies that are coming out in China are giving us information in the United States. Studies that are coming out in Europe are giving us information around the world. It's just this group of scientists trying to figure out what's going on. And that's why I'm going to close with the same point I made last time, which is you have to trust science, but you also have to understand that this is a process in evolution. And I may say something today that's current in the literature, and the CDC may change it a week or two from now. And that is not because we are following some political trend. It's because that's the way science works when something is new.
It's not misinformation if you get new information next week.
Exactly.
Okay. Hey, Dr. Testa, thank you very much. Look forward to seeing you next week. Have a great weekend.
You too, Phil.